So the coronavirus, or COVID-19, has become very serious. I'm sure it's been very serious for a while, but there's finally a universal acknowledging of it being very serious. The World Health Organization has officially declared it a pandemic. And it brings me no pleasure to tell you that in the United States, our disaster response, our pandemic response, is abysmal. So there are some countries that are handling it properly and doing a good job, and then there's other countries that aren't. We're on the list that isn't doing it well. So first of all, one of the things that rocked Twitter last night, apparently Tom Hanks and his wife now have coronavirus. They're in Australia. They basically got the test right away. They have it. Then the one that I was like, whoa, when I saw it, there's an NBA player on the Jazz by the name of Rudy Gobert. He has it, but not only does he have it, he's been like willy-nilly with touching things and being around people, and apparently as a result of Rudy Gobert having it, he's already spread it to another player, Donovan Mitchell. There's one other player on the Jazz who has it. Any team that the Jazz have played in the past 3 or 4 days, you got to keep your eye on them. They absolutely have to be quarantined. I think they played the Raptors recently. I know that they actually recently played the Knicks, and Corin has told me he used to work at Madison Square Garden for the Knicks, and Corin told me that he still has friends who work there. They're already quarantining those people and saying, hey, look, you got to spend 14 days away. The NBA suspended the season. I've never heard of anything like that before. I mean, maybe the last time there was, games suspended, apart from Kobe Bryant's death, which just happened. Before that was like 9/11, and it was only obviously for, I don't know, maybe a couple days or a week. They're indefinitely suspending it. And so, we have to see how long the pandemic lasts before we revisit and, change course. The other thing that's absolutely wild, Donald Trump was with Brazilian President Jair Bolsonaro at Mar-a-Lago in Florida recently. Come to find out, one of Bolsonaro's cabinet members, I believe his communications director or something like that, he was exhibiting symptoms of the virus. That dude got the test. Apparently, news just broke right before I came on air. He's got coronavirus. His wife has coronavirus. So that means the Brazilian president, Jair Bolsonaro, might have it. But beyond that, dude, there's pictures of, all these characters with Trump at Mar-a-Lago in close proximity to him. So there's a decent chance that the president of the United States might have this. So, I highly recommend, because some of you are probably listening to this going, okay, but what exactly does that mean? I don't have a conception of what that means. I don't blame you if that's how you feel, because that's how I felt yesterday. But what I did is I watched the podcast. There's this guy by the name of Michael Osterholm. He's a public health scientist, a biosecurity and infectious disease expert. He's the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He was in the Minnesota Health Department from 1975 to 1999, and he's on the National Science Advisory Board. Now, I give you all that information about how solid his record is, because now I'm going to tell you he was on Joe Rogan's podcast. So I know, when you say Joe Rogan, some of you guys will be like, really, bro? You're going to get science advice from Joe Rogan? No, I'm getting science advice from a public health scientist, biosecurity and infectious disease expert, director of the Center for Infectious Disease Research and Policy at the University of Minnesota, Minnesota Health Department, dude from 75 to 99, and National Science Advisory Board member. So the dude he's as big of an expert as you could possibly get on this issue, and I highly recommend you go watch that podcast, or at least there's like a 15-minute clip out there that sums up exactly what the coronavirus COVID-19 is, exactly how deadly it is. To sum it up in layman's terms, the coronavirus is anywhere from 10 times to 30 times worse than the flu. So in terms of death rate, we're talking about anything from 3% to 6%. Obviously, people who are older are more at risk. People with compromised immune systems are more at risk. But, you know, it's bad. It's bad. It is a genuine pandemic, as the World Health Organization has already declared it. So that's why you're seeing unprecedented measures now. The stock market plunged multiple times, and we'll get into more of that in a second. But Trump gave an emergency address from the Oval Office last night. I want to show you the meat of it. This is, I don't know, maybe a 5 or 6 minute clip here, but I think it's important for everybody to hear what he has to say. And then I'll come back and give you more information.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom. At the same time, we are monitoring the situation in China and South Korea, and as their situation improves, we will reevaluate the restrictions and warnings that are currently in place for a possible early opening. Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. We are cutting massive amounts of red tape to make antiviral therapies available in record time. These treatments will significantly reduce the impact and reach of the virus. Additionally, last week I signed into law an $8.3 billion funding bill to help CDC and other government agencies fight the virus and support vaccines, treatments, and distribution of medical supplies. Testing capabilities are expanding rapidly day by day. We are moving very quickly. The vast majority of Americans, the risk is very, very low. Young and healthy people can expect to recover fully and quickly if they should get the virus. The highest risk is for elderly population with underlying health conditions. The elderly population must be very, very careful. In particular, we are strongly advising that nursing homes for the elderly suspend all medically unnecessary visits. In general, older Americans should also avoid non-essential travel in crowded areas. My administration is coordinating directly with communities with largest outbreaks, and we have issued guidance on school closures, social distancing, and reducing large gatherings. Smart action today will prevent the spread of the virus tomorrow. Every community faces different risks, and it is critical for you to follow the guidelines of your local officials who are working closely with our federal health experts, and they are the best. For all Americans, it is essential that everyone take extra precautions and practice good hygiene. Each of us has a role to play in defeating this virus. Wash your hands, clean often used surfaces, cover your face and mouth if you sneeze or cough, and most of all, if you are sick or not feeling well, stay home. To ensure that working Americans impacted by the virus can stay home without fear of financial hardship, I will soon be taking emergency action, which is unprecedented, to provide financial relief. This will be targeted for workers who are ill, quarantined, or caring for others due to coronavirus. I will be asking Congress to take legislative action to extend this relief. Because of the economic policies that we have put into place over the last 3 years, we have the greatest economy anywhere in the world by far. Our banks and financial institutions are fully capitalized and incredibly strong. Our unemployment is at a historic low. This vast economic prosperity gives us flexibility, reserves, and resources to handle any threat that comes our way. This is not a financial crisis. This is just a temporary moment of time that we will overcome together as a nation and as a world. However, to provide extra support for American workers, families, and businesses, tonight I am announcing the following additional actions. I am instructing the Small Business Administration to exercise available authority to provide capital and liquidity to firms affected by the coronavirus. Effective immediately, the SBA will begin providing economic loans in affected states and territories. These low-interest loans will help small businesses overcome temporary economic disruptions caused by the virus. To this end, I am asking Congress to increase funding for this program by an additional $50 billion. Using emergency authority, I will be instructing the Treasury Department to defer tax payments without interest or penalties for certain individuals and businesses negatively impacted. This action will provide more than $200 billion of additional liquidity to the economy. Finally, I am calling on Congress to provide Americans with immediate payroll tax relief. Hopefully, they will consider this very strongly. We are at a critical time in the fight against the virus. We made a life-saving move with early action on China. Now we must take the same action with Europe. We will not delay. I will never hesitate to take any necessary steps to protect the lives, health, and safety of the American people. I will always put the well-being of America first. If we are vigilant and we can reduce the chance of infection, which we will significantly impede the transmission of the virus. The virus will not have a chance against us. No nation is more prepared or more resilient than the United States.
So that is definitely not true. There are many nations that are way more prepared than the United States. So the best response has been in Taiwan and also in Singapore. They've had a really, really good response, and it's mostly because they've had, experience with previous outbreaks, I don't know whether it was SARS or MERS or one of these other outbreaks. But as a direct result of that, they were prepared. So there's a lot of, stockpiling of the necessary treatments and the masks that are needed, the protective gear, the tests. So there are many countries that are handling this really well. And I forget where it was. It may have been Australia, but maybe South Korea. I don't remember, so don't quote me on it. But there is at least one country, maybe multiple countries, where they almost have drive-through testing, which is what? Now, here in the United States, we have a massive, massive shortage of the tests. We have a shortage. So our response is more like Iran, and they're getting hammered right now with this. And it's also more like Italy. Northern Italy is getting obliterated by this. And there's I read a very, very concerning article about some of the really scary life and death decisions that are being made in Northern Italy because there's the hospitals are overrun. People are in hallways. The older folks who get this struggle breathing. They need to be on a ventilator, and they're having to make these very, very heartbreaking decisions as to, we only have a limited number of ventilators, who gets it and who doesn't. It's almost like some people are being sentenced to die, and they're choosing, okay, I guess we got to go with the ones who are younger and healthier and more likely to survive. So some people are basically being left for dead. Now, if you're not scared yet, listen, man, a lot of the things that we need to deal with this pandemic, a lot of the stuff, we have supply lines from China, and we don't we're totally unprepared on our own to deal with this. A lot of the medicine that we need, the masks that we need, that infectious disease expert told a story about how apparently 90% of the world's IV bags are made in Puerto Rico. This isn't directly related to this pandemic, but his point was 90% of the IV bags were made in Puerto Rico, and then when they got obliterated by a hurricane, the whole world had a crisis as a result of that. So this is the same thing we're experiencing with, the masks that we need, the protective gear that we need for this, some of the treatments, the tests that we need for this. We're totally unprepared. And by the way, just, a quick little side point, this is what people like me have been screaming about for a long time, is that free trade is good insofar as it's a necessity. But unfortunately, in many instances, we've become too dependent on the supply lines to countries that are we're somewhat hostile to them and they're somewhat hostile to us. If they wanted to, they could just cut the supply line. And in fact, now the Chinese government is putting pressure on the U.S. government over their cell phone company, Huawei. And they're like, hey, man, you guys aren't allowing Huawei into U.S. markets. Interesting. Well, I guess we'll have to take a look and review whether or not you'll be getting these masks and this necessary protective gear. Here we go. See, this is why, I've been screaming, one of the reasons why I've been screaming at the top of my lungs, that we need to become a manufacturing hub in this country again. We need to be self-sufficient. Again, trade out of necessity where you need, but all the supply lines for necessary medicine shouldn't be traced back to China where they can just pull the plug whenever the hell they want. I mean, this is madness. So we have a shortage of tests. Unfortunately, a lot of the health professionals are undertrained and don't know how to deal with this. I read a just terrifying Twitter thread about a dude who had come into contact with somebody who came from the region where there was a hotbed of this, and then he was exhibiting symptoms. He waited 2 weeks, and then he went into the hospital, and he went right to quarantine, and they were testing him with all the frickin', gear on, the protective gear, and they gave him the test and said he's clear, but apparently he had only gotten the test for the coronavirus, not for COVID-19, which is, I guess, the specific strain of coronavirus, and he's in limbo. He keeps trying to call and ask, and they're like, oh, you got to call this lab. He calls that lab's like, oh no, we don't have it. You got to call the original nurse who was doing the test. Oh, Jesus Christ. So he's calling all over the place, and they're like, yeah, they didn't do the test right. So here's this dude, he might have coronavirus, and he could have spread it in 1,000 ways to Sunday. He goes in for testing. They can't even tell him if he has it. So this is how unprepared we are now. Officially in the United States, this is the official number. We have 1,000 cases. Those are people who've been tested, confirmed they have it. But the reality of the situation is, as any infectious disease expert will tell you, the actual number of cases, the real cases that exist, are way more than 1,000. Way more than 1,000. So, and also it's possible you could spread it without exhibiting symptoms. The former head of the CDC said that when all is said and done, not to scare you too much here, former head of the CDC, half of the United States population could be infected and 1 million people could die. At least 150 million people infected, 1 million people can die. This is a pandemic. We're watching a pandemic. Now, the Spanish flu, to be fair, was a lot worse. But what we're talking about here, again, is 10 to 30 times worse than the flu. So this is not good, and that's why you're seeing, a bunch of chaos happening and mayhem. And my hometown where I grew up, they quarantined it because there was one dude, a lawyer, who lives there, and he, I think, went to a synagogue, and it spread all over the place, and they were like, all right, well, we got to shut it down. So they shut down the shopping center I worked when I was younger. I worked in one of these shopping centers. They shut it down. They sent in the National Guard. This is serious, man. This is really serious. Now, let's go through some of what Trump said there. He said he's banning travel from Europe, but not the UK. Okay, listen. The UK has more cases than almost anywhere else in Europe except Italy. So that's totally arbitrary that he's saying, oh, well, not the UK. Why? My guess is because of our relationship with the UK government. They didn't want it banned, and all right, fine, we won't ban it. Okay, but then it's more, guys, this is more of a PR thing than like, oh, this will keep us safe thing. Then he said, oh, we're going to waive co-payments for the coronavirus treatment. Well, the insurance companies came out immediately after the speech and they said, we didn't say that. We said we'll waive payment for the test, but the treatment, you're on your own. Oh, Jesus Christ. So now we could have people with the freaking coronavirus who are like, I mean, what am I going to do? I want to go get treatment, but right now my symptoms, I guess, are just like the common cold or like the regular flu. I'm not going to go to the hospital. What if I get hit with the bill for $5,000 or $10,000 to try to treat me for this thing? I don't have that kind of money. What am I going to do? So Trump just went out there. He made it up. He's like, yeah, they said they'd waive, payments for the coronavirus treatment. Now, by the way, I wish that was true, and I hope that the president saying that would have maybe pressured them into doing it, but they came out immediately and were like, no, we said the testing, not the treatment. Oh, my God. See, if only there was a presidential candidate running who was in favor of universal health care, Medicare for all. But I digress. Now, also, he said small business administration loans, they're going to give a payroll tax cut, which is so on Republican brand. Oh, we have a pandemic? Will some tax cuts help? Let's try tax cuts. There were separate stories about a bailout of certain industries. I'm sure that is going to pop up more in the coming days. Guys, the airline industry is getting hammered, son. Hammered. United just announced we're cutting at least 20% of our flights for the foreseeable future because, obviously business is getting hit. But listen, ultimately, I'd rather have business hit than have people die. So, yes, the main thing that you could do to stay safe is what they call social distancing, which is just a fancy way of saying don't go outside as much as possible. Don't be around people as much as possible. I understand everybody's got to work, and what are you going to do? You got to do what you got to do, but as much as humanly possible, keep your distance. Keep your distance. And they always say, of course, wash your hands like crazy. Just all unnecessary contact, all big gatherings. Do not do it. Do not go to any big gatherings. And by the way, the bailout of industries that we're talking about here, that's literally like corporate socialism. This is exactly what Bernie Sanders talks about, that Donald Trump and various establishment Republicans and establishment Democrats, their whole thing is like, well, no, I'm totally fine with socialism as long as it's for my donors. And that's exactly what we're talking about with these bailouts in the wake of this emergency. And what we really need, the real answer to this, is more aggressive action. And it honestly is universal paid sick leave, some form of UBI right now, universal basic income, and Medicare for all. I mean, that's what we need. And obviously you need more disaster preparedness. You need, they had cut the CDC budget. They cut Health and Human Services. They laid off the pandemic experts that we had in 2018. And now they're caught with their pants down and they don't know what the hell to do. So obviously this is one of those instances where, yes, a Democratic administration, even fill in the blank with whatever Democratic administration you want, even ones that are centrist and annoying and corporate, I have no doubt Obama would have handled this a lot better than Trump is handling it, because they at least believe in, okay, we'll have a functioning Health and Human Services and have a functioning, CDC and have pandemic experts, because what are we, idiots? They fundamentally don't believe in government. Guys like Trump, the only time they believe in it is to do the bailouts of the industries because that's their buddies. So the market, just so everybody understands, absolutely plummeted. Absolutely plummeted. As soon as Trump gave this Oval Office announcement, which was meant to kind of like quell fears and say, hey, we're on it, the futures dropped so sharply. Today, when the market opened, immediately everything plunges. They paused trading. Because it was so bad. That's the second time this week that the market had to stop because everything was falling off of a cliff. So it looks like, that giant crash that we were talking about, it looks like it's here now. And how's this for a shocker? The catalyst was a global pandemic. You guys know I've been giving my spiel for how long now? For years, saying, listen, The bubble's reinflated. It's going to burst at some point. I don't know what's going to be that pin that pops it. I don't know if it's going to be the housing bubble repopping. I don't know if it's going to be the derivatives market. I don't know if it's going to be student loan debt crisis or credit card debt, whatever it is. I know that bubble's going to pop. It's just a matter of when. And apparently, the thing that's popping it is a global pandemic. At the end of the day, the most important thing is for the future, we have to change those supply lines. We have to be more self-sufficient, and also immediately call in the experts from Singapore, immediately call in the experts from Taiwan, because they're handling this so well. And whatever they did is what we need to do. But we're wholly unprepared. And one of the main reasons is our system is totally broken. Our healthcare system is criminal. It's made for price gouging. It's made to give all the money to the mafia middlemen in big pharma and the for-profit health insurance companies. So, the profit motive in our healthcare system is largely responsible for this, as well as having an administration that's corrupt and just doesn't believe in good government. So, we need better disaster preparedness. We need to fully fund the CDC and HHS. We need to make sure we have these tests widely available. We have to listen to the World Health Organization. We have to follow the lead of the governments who have experienced pandemics like this before and are prepared and ready and know how to deal with it. Because right now, I'm not kidding when I say our response is more like that of Italy and more like that of countries that were harder hit than it is of Taiwan and Singapore, who kind of nailed it. Even China, they acted aggressively as soon as the outbreak happened in Wuhan. And so their response in many ways is better. Now you could say, hey, they're an authoritarian system, so they're like almost by nature, it's easier for them to handle a situation like this. That's true. But I think even the most civil libertarian of civil libertarians, myself included, we all understand that in times of a pandemic, if there was ever a time to have really important orders for health reasons followed, this is it. This is like the one instance where it's like, I get it, man. I get it. Freedom of travel or whatever is temporarily restricted. We're going to have a process that everybody has to follow. I get it. I think all other civil libertarians get it. This is a unique situation and it requires a unique response. So, here we are. I don't know how long this is going to last. I don't know just how disastrous the effects will be, but I'll finish again by recommending to you, I highly recommend you watch that podcast with the infectious disease expert. Again, his name is Michael Osterholm. He's a public health scientist, biosecurity, and infectious disease expert. He's director for the Center for Infectious Disease Research and Policy at the University of Minnesota. He was in the Minnesota Health Department from 75 to 99, and he's on the National Science Advisory Board. He was on Joe Rogan's podcast. Watch that and listen to experts like that. And by the way, there's a lot of misinformation out there too. Don't trust sources that you can't verify immediately. If you find out that somebody's legit, okay, great, then trust them. But your default assumption should be the person doesn't know what the hell they're talking about. Random Facebook posts, whatever the hell, because there is a lot of misinformation out there. But anyway, everybody have fun on their own little isolated island as much as you possibly can and avoid big public gatherings. And a lot of them are being banned. And I expect to see more of that, in the coming weeks and months. But hang in there.